My name's Paul Armistead. I'm a bone marrow transplant physician at UNC Chapel Hill. Most of the patients I serve at UNC are patients who have hematologic cancers, hematologic malignancies. Those are typically patients with leukemia, lymphoma, and multiple myeloma. When I first meet patients as a transplant physician, oftentimes they have already been told that they have cancer. So the initial shock of the diagnosis has sort of subsided because they're seeing me after that and being told to them. A lot of what my job is up front is to just talk with them about this rather scary and nebulous procedure called transplant and why that may be something that would be beneficial to them with the hopes of either providing a very long remission or actually curing the patient. So a lot of what's spent in our first appointment is really just talking, listening to the patient, hearing what the patient understands about his or her disease, how they've tolerated their prior therapies, but then a lot of time also just explaining what this process called transplant would look like. What I like about UNC is the fact that I really feel we are a much more patient-centered and patient-focused institution than a lot of other places. Our patients in the transplant clinic, I know them personally very, very well, but our patients know our nurses, they know our nurse practitioners, they know our PAs, they know our pharmacists, they know our transplant nurse coordinators. They know them on a very deep level. They really feel, the patients feel that there are healthcare providers throughout our clinic that know them on a personal level, know their caregivers on a personal level, and have very close relationships. And as a scientist, I have a lab over in Marsico Hall, which is on the med school campus. We actually study immune responses to leukemia to try and improve our therapies. So my lab is working on cellular therapies and vaccine therapies to try and improve our transplant outcomes and to improve our outcomes in treating patients primarily with leukemia, but other blood disorders. I'm pretty busy. Pretty busy at work. In terms of things that I enjoy doing outside of work, apart from lounging in a hammock, I like racket sports. I play indoor badminton, I play racquetball, I enjoy those. I play tennis, I'm not very good at that. So those are fun things. I grew up in Scotland. I started practicing a bagpipe chanter, which is the breathing in part to go to a full bagpipe. And so if I get good at that, I'll pick up the bagpipes, but I've got to convince the rest of the family on that one, so not ready yet.